Hi, I am Milka. Today we are going to talk about sexually transmitted disease, also known as sexually transmitted infection. There are many different types of STD. One of the common STD, especially among people ages 15 to 24, is chlamydia. Now Jane will give more specific information about chlamydia. Jane is family nurse practitioner at City College of San Francisco.
Chlamydia is a sexually transmitted infection caused by a bacteria. It can infect both men and women, and unfortunately, if it goes untreated, it can lead to serious permanent damage of reproductive organs. Chlamydia, again, is a sexually transmitted infection, so it's transmitted through any kind of sexual contact, through bodily fluids, so through anal sex, oral sex, and vaginal sex. In women, the bacteria first can infect the cervix and or the urethra. Some infected women have abnormal vaginal discharge or a burning sensation when urinating. Untreated infections can spread upward to the uterus and fallopian tubes, causing pelvic inflammatory disease, also known as PID. PID can be asymptomatic or can cause symptoms such as abdominal pain or pelvic pain. Even if PID does not cause any symptoms initially, unfortunately it can lead to infertility or other complications later on. Chlamydia can be prevented through the use of barrier methods, both female and male condoms. Another way is through abstinence. Clearly, if you're not sexually active, the risk is reduced, if exists at all. And the other way that it can be prevented is through monogamous relationships. Clearly the risk isn't eliminated completely, but the fewer partners you have, the less risk you have of being exposed to chlamydia. So there is a recommendation to get tested for chlamydia annually, regardless of symptoms. Clearly, if you have symptoms, you should be come in for testing more regularly, but it's absolutely reasonable to test once a year to prevent the infection from going unseen.